Thank you for joining us. We're here today to talk about how integrative health changed everything for our panelists, all of whom are graduates of our Integrative Health and Lifestyle program. I thank them all for coming and sharing their time. I just wanted to share the variety of professions that are represented here in our behavioral and mental health alumni panel, as well as what years folks graduated from. So we have Paul Bacher, who's an IHeLp 2014 graduate, so like our very first year we launched. He's a licensed professional counselor, but he's also owner of a very successful business that provides mental health care to the state of Arkansas, as well as diving into the wellness sphere and coaching. We have Teresa Hudgens, who just graduated from our program this year in 2025, licensed clinical social worker. And Linda, you graduated in 2021. You are coach supervisor at the San Francisco VA. And Lisa, you graduated last year in 2024 and a veteran psychologist of over 45 years in Colorado. So I'm going to go ahead and stop sharing my screen so we can see each other. Thank you everyone for coming. I really appreciate it. I'm going to get our panelists spotlighted, and then we'll get to the interesting part of hearing from them and not from me. But I should introduce myself. I always forget to do that. I'm Molly Burke. I'm Director of Online Education here at the Andrew Weil Center for Integrative Medicine. I'm also Program Director of our Integrative Health and Lifestyle program that we'll be talking about today. So we're going to get Linda spotlighted. And there's Lisa. Let's spotlight Teresa and Paul. Awesome. Good to see you all. So I'm going to start with Lydia. Will you just give us a little bit about yourself, where you're joining us from, what's your professional background, and what are you currently doing professionally?
Did you want to?
Oh, sorry. So Lydia, did you hear? Oh, sorry, I called it out too quickly. Lydia, do you want to give us a little bit about your
Linda or Lydia?
Oh, Linda, oh my God, I'm so sorry.
That's okay.
Linda,
I was
I'm
like
so
thinking, well, I don't
sorry.
see a Lydia.
I had it wrong on here. I had it.
Where
My
did Lydia
apologies.
go?
There's no Lydia.
Oh, okay.
There's just a typo on my page.
It's
That
okay.
I shouldn't have to look at. Sorry,
All
Linda.
right. No worries. Well, as Molly said, I graduated in 2021, and my background is I'm trained as a clinical psychologist. I've been at the San Francisco VA over 20 years, and I started out in doing neuropsych for brain health. And then all this buzzing came around about integrative health and stuff. And I've been very fortunate that our VA has an integrative health service. And the chief of that program, she is a physician that went through the Andrew Weil program and was super excited about it. And thus, I was able to come through the IHeLp program at a time when we were just getting introduced to coaching. And some of you might know that the VA is big with whole health coaching. And so I was able to get involved with that. I've worked as a whole health coach at the VA for several years. I'm the lead for the program, and I'm also certified through the the International Coaching Federation, because I got trained in leadership coaching. So IHeLp has been phenomenal because we have an integrative health service. And so it's been foundational for everything that I do and for everybody I teach and mentor. So that's me.
Thank you so much, Linda. Paul, will you tell us where you're coming from, a bit about your professional background and what you're currently doing?
Yeah, I'm owner and founder of Hope Behavioral Healthcare, which is a mental health agency, and we provide services in 10 counties in the state of Arkansas. I'm also a supervisor for beginning counselors, licensed professional counselors, licensed associate counselors. And supervise them, work with universities and supervise interns in their program. Also supervise postmasters, beginning counselors as they move toward their terminal licensure. I've been a mentor supervisor for the Center for Integrative Medicine at the University of Arizona for a few years. I'm a graduate of IHeLp and a graduate of the coaching program there. And I'm also a board certified coach in BCC and a nationally board certified health and wellness coach. And I provide coaching services also. So that's a little bit about me. I'm from Arkansas, not Texas, but I sound like Texas kind of dialect, but I'm in the foothills of the Ozark Mountains on a natural fed spring river, and I'm in um, one of the poorest counties in the state of Arkansas, and we provide services to the underserved and to a variety of populations.
Paul keeps busy.
Stay
Well,
busy.
Lisa, will you tell us a bit about yourself?
Certainly. Well, so I'm coming to you from Fort Collins, Colorado, which is just sort of north of Denver, not too far from the Wyoming border, actually about 45 minutes or so. And as Molly shared, I finished the IHeLp program in July of last year. And I was so thrilled to do that because the year before I had completed a postdoc master's degree in clinical psychopharmacology because Colorado was at that time looking to allow psychologists to prescribe traditional medication. And so that bill actually passed. And we're pretty excited to participate in that. But when I got done with the clinical psychopharmacology program, I realized that I didn't have the integrative health piece. So I sort of shopped it out. I looked all over the country, and it was real obvious pretty quickly that this particular program was the best fit for me. So it really complemented the training that I have had. I am also a clinical assistant professor at the University of Colorado School of Medicine. And there I am an NIH researcher for Project ECHO, which is a national endeavor to better understand environmental exposures to child health outcomes. And my particular interest is in exploring prenatal exposures and neurodevelopmental outcomes in children. I am the clinical director of the Alpine Behavior Therapy Clinic here in Fort Collins, and so I stay pretty busy. I focus on treating adults and children with autism spectrum disorder, attention disorder, and any other comorbidities. And I'm also a certified brain injury specialist. And so what that means is that I work very closely with individuals who have post-concussive syndrome or traumatic brain injury history, usually from motor vehicle accidents and other kinds of unfortunate occurrences. So that's pretty much what I do. I stay busy also. And I'm originally from Louisiana, so kind of next door to where Paul's from.
Thanks so much, Lisa.
Yeah.
Teresa, let us know about you.
Yeah, so I am joining you from Palmer, Alaska. I have a clinical practice here in Palmer, a clinical group practice that I kind of developed with a business partner here to kind of help some of the individuals that we see who have complex trauma, whether that be via military trauma, childhood trauma, different types of assaults that we see that are common in this area. A little bit about my background. I worked in inpatient care. I worked inpatient acute psychiatric care for adolescents for many years, working with the children and family. and in that interdisciplinary team. And that is something that I really missed and have been missing for a while, whether, I've worked at the VA for a while too, and still being able to have that interdisciplinary team where we all come to the table and look at every aspect of this person's life to gain understanding of not only their mental health, but also their physical health and how they're so intertwined. And that's kind of why I went on this IHeLp journey, because that is very interesting to me, how we can bypass the fact that our mental health is so closely connected to our physical health. And, it's either passing it off to the mental health professionals or passing it off to the medical professionals, and we're not coming to the table together. So that was my goal in coming into this program. And I'm hoping that I'm able to gain a little bit more understanding and help my community in understanding that too.
Thank you so much, Teresa. It's definitely the thread that runs through all of the design and the efforts of our IHeLp to be interprofessional to support those integrative health teams that we're hoping to see grow and happen in more and more places. And how can we all work together towards the health of our patients, our clients, and our community? Can I stick with you, Teresa, for now and ask what are one or two elements from IHeLp that were most meaningful or impactful to you on a personal level, personally?
I think being able to gain a little bit more understanding about my own personal health and my own health journey, learning more about how the smallest aspects of my diet can not only affect like how I feel physically, but then, how I feel emotionally. I think that was really impactful to me. I also really appreciate how we had such a wide variety of people from different backgrounds in our cohort. And it didn't matter like if you were a clinician or if you were a physical health person, nurse, doctors, whatever. We were all coming to the room together, and our knowledge was appreciated. It wasn't, more than me or any of that. So I really appreciate how respected I felt in this program.
Thank you. Lisa, what about you? One or two personally impactful?
Sure. Well, I'm considered a health psychologist. That's really what my PhD is in. And I loved the program's approach to the biopsychosocial model. I think that is the model that we're headed towards. I think it's practical. I think there's great efficacy in thinking that way, in that paradigm, kind of whole person. So I felt like when I was learning the material that was introduced in this program, I was applying it both for myself and also cataloging it in my head for utility with my patients. But the little pearl that I took from this program was nature bathing. And I share with everybody who will listen about nature bathing, and I applied it for myself. And I consider myself a naturalist anyway, because I'm also a nature photographer, and usually wildflowers. But to look through a fresh lens at how nature is restorative and can assist in the healing trajectory for people was just a wonderful, fresh perspective. And again, I've kind of reshuffled the deck for me as a health psychologist. And so now I share that recommendation to all the people that I treat and all the people that I know. So something as simple as, sitting outside and watching the birds or the squirrels or watching the seasons change and just looking intently and spending some time in nature, I think is just fabulous. And again, it was the pearl for me from this program.
Wonderful. Thank you so much.
Mhm.
Linda, what about you? One or two items from IHeLp?
Well, again, I'm going to echo what both Lisa and Teresa said. I mean, I think it opened a huge world, especially when you're on an academic path and you get a degree in mine's in clinical psych in a certain thing. We focus on what we studied. And IHeLp just opened it up to so many different things. And that is so funny because back in 2021, I wrote on a sticky pad Shinrin Yoku, which is forest bathing in Japan. And ever since then, I've talked about it with everybody. And it wasn't just nature, it was we were exposed to teas, we were exposed to guided imagery, all the things that when you're in a very narrow field, you don't get exposed to. And it was like, wow, this is what everybody has to know about everything, right? And then we can specialize, no doubt, but certainly being exposed to all the different healing modalities and understanding about ancient healing practices that go beyond Western medicine, and in completely embracing Western medicine with it, it was just really it was life-changing, certainly. I mean, and for me and the way I looked at things, and like I said, the way I will interact with everybody professionally and personally. And everybody's always like, oh my God, Linda talks about forest bathing all the time. So there you go. Yeah, it's impactful. It really is. So yeah, that's me.
Wonderful. Love it. Paul, what about you? What do you want to share about IHeLp that was personally meaningful or impactful?
One of the biggest things for me, if not the biggest, was the research and evidence-based support for the interconnection between mind, body, and spirit, that how one impacts the other. And the seeing the research of how you can make changes in the body and how that impacts you spiritually and emotionally in the mind was fascinating. And now took the cloud away from what's real and what's not real, of what you could trust and what you couldn't trust. Not that traditional wisdom has a tremendous role in what we do, but it was like confirmation of traditional wisdom of the relationship, the interdependence of mind, body, and spirit. And so that not only opened my eyes more clearly, it motivated me to be even more intentional about focusing on those interventions that help me personally in mind, body, and spirit to improve my overall health, to know that forest bathing or nature bathing, or to know that meditation or yoga, all that, to see the science that supports how it impacts depression, anxiety, cardiovascular issues, pulmonary issues, neurological issues, how all of that combined was really powerful and motivating and still is today for me personally. That's one. And then briefly, and I'll probably talk later about the self-care aspect of it. It's beautiful, powerful. The focus on taking care of oneself, which empowers us to help others in a more effective way. Lots of things that was really meaningful and powerful for me in the IHeLp program.
Thank you, Paul. I was totally going to bring up self-care right after your answer, because it from the very first class we offered in 2014 to, our next class in 2026, that has been a constant part of the design, is that we want our students to apply what they're learning to their own self-care, right? Put that oxygen mask on yourself first, before you can help others. And it's not just talk, it's really about dedicating space and time for students to learn through that self-application, to take care of themselves, and to say that's as valuable as learning and passing those exams or doing a graduation project. So thanks for bringing that up. I'm going to stick with you, Paul, and just say, if you want to talk about from a professional perspective, which I know they like overlap, and what you've talked about overlaps, but what are you, one or two things you're incorporating from what you've learned in IHeLp in your professional life?
Well, in my professional life and then also in my company, what we do, we have in-service and we have presentations, and I do many of those about the interaction of mind, body, and spirit, and how we can make certain changes integratively that can impact us emotionally and spirit and mentally. And so we have our treatment plans that we have on each client. And so I encourage my therapists to help our clients work on certain integrative approaches to their mental health, such as nature, meditation, yoga, self-care practices. And that's one of the things. So the self-care elements are the integrative interventions are utilized in the treatment plans of our patients, and we have trainings in our company for that. Another thing that I've done is, and we have a self-care initiative where we encourage our clinicians and also all of our people in the workforce to develop a SMART goal, which and they're incentivized for doing self-care in our company. We do it with gas cards and other ways of rewarding our people who approach who do self-care. And so we, like, one quarter we did, and the team chooses what self-care practice they want to do. And it could be meditation, it could be nutrition, it could be some form of movement. And everyone who participates in that self-care initiative for that quarter gets rewarded with a gas card, or monetary incentives. So that's part of it, because I'm convinced that, as you mentioned, Molly, that we're only effective with the people we treat as we are effective with ourselves. And so if we're taking care of ourselves as clinicians, we're more effective with the people we serve. And so that's a big emphasis. So those are a couple of things that I've been able to do, among others, professionally in our companies.
Thanks, Paul. Appreciate it. Now, Teresa, I know you just graduated, but I think one of the things that's great about the IHeLp training is, like, as you're learning it, you can be applying it. You don't have to wait until like this point that you're doing one thing or the others. But I just wonder what you might want to share about what you've been able to implement in your professional life.
Yeah, I think for me, because I tend to be an attachment-based therapist, and all the therapy that I do with my clients, I always go to that attachment piece. I feel like this has given me more language to give to my clients on understanding how that attachment piece for them is so crucial in their emotional and physical development in life, and how that all kind of stems from our nervous system, and how our nervous system reacts to those connections very early on in life, and how they connect to us now. And kind of similar to what Paul had said with staff, we have meetings. The last meeting that we actually had at a salt cave, just so that we could practice some of the self-care aspects while learning something new, not just for ourselves, but what we can share with our clients. I still have a whole list of things that I want to introduce to clients and staff, of things that I learned, and excited to kind of put some of those things in practice. But just trying to also settle with my knowledge and how I can incorporate it for myself for right now too.
Wonderful. Thank you. Linda, what about you? How are you incorporating what you've learned?
Well, I feel really fortunate, as I mentioned, that I work in an integrative health service. And so we are a specialty medical team that works with veterans out of the San Francisco VA. And I work every day at being able to introduce these concepts and being able to speak to veterans about yoga, about mindfulness, about being able to go outside and to enjoy nature. We have groups that address these things, and very much the focus is on a holistic way of looking at it. And holistic, asking each person what is important for them, certainly, right? And starting from there. And, it's a cliche, but everyone says it. Instead of coming from what's the matter with you to what matters to you, right? And it's a shift in the way the medical community can interface with people. And so it's profound, right? So someone can come to the pain clinic and talk about their pain forever, and then you don't realize that they've just been helping a family member move for the past week. And so it opens the door for us to actually engage with people and not a symptom, a diagnosis, a condition, and really be able to offer a holistic approach to how they can heal, and most of us don't know what that is. And so being able to be exposed and offer a menu, which was so phenomenal with IHeLp. I mean, we all know yoga and mindful, but the menu was so vast, that it's just incredible to be able to, integrate that in any kind of, health healing, environment.
I love it. Thank you, Linda. Lisa, what about you? Can you narrow it down to 1 to 2?
Well, I think so. I love what everybody's saying, and I agree with it. I think that the IHeLp program was a wonderfully validating, informative, evidence-based springboard. It was exactly what I was looking for, so that when I came back to this office, where I am, 4 or 5 days a week, I can speak with integrity, with confidence, and convincingly sharing with people about the ancillary approaches to whatever their maladies are, or their mental health conditions, or physiological complicated circumstances. It's just really very freeing to be able to share that kind of information with people, and to know where it came from, to be able to cite it if I needed to. And it's a fresh lens for patients who have maybe been struggling with, taking a long list of Western medicines that have potentially been useful, but maybe not to the degree that they're looking for. So to be able to add to that and say, well, here's an assortment, whatever it was that said a menu. I think, Linda, that was you. I love that term. This is where we're headed. And, this is an inevitable shift that is just going to free a lot of people. And it's logical to assume that we have it right under our nose, but we need to recognize it. We need to have edification about it. We need to share that with our patients. So that's what I've been doing fast and furious since about this time last year, when I, got my little certificate up here on my wall here. And I'm like, well, I know what I'm talking about here. And people are just very, their eyes just open. They go, gee, thanks for letting me know that something like aloe vera gel might help heal an inflammatory condition. And, something as simple as that. It's just great to be able to have that, like I said, in my repertoire. And I credit the program completely for that.
Thank you so much. I've loved hearing from all of you about your personal and professional experiences. I'm going to start with Teresa on this last question. For those who are in the mental behavioral health field, what do you see as the key benefits of completing Andrew Weil Center's IHeLp program?
I think it kind of goes back to what I had said in the beginning. There are very few programs or trainings or anything that we can go to that is interdisciplinary, where we can all come to the table and learn together, and be able to share our own experiences and our own knowledge and be heard and valued. And I think that for me, that was such a profound piece of this program, of having a seat at the table in a way, right, with all of these amazing professionals, and being part of that is amazing, because we all
A little Alaska freeze here. All right, she's good. She's going to catch back up to
tend to go into a program that is medically based and feel comfortable and at home in that program. And this program did that, and I appreciate that.
Thank you so much, Teresa. Really appreciate it. I'm going to go to Linda. Linda, what are your thoughts about the key benefits?
Well, I think most of us that wander, let me say that, and end up in the behavioral mental health world, have an intuitive belief in the human person, right? And so we're trained all about our theories and the way to look at things. And I think when we're able to expand it to the whole person, it just, and I think this is what Teresa said, it just opens a whole new world. And I think that, IHeLp, again, what Teresa was saying about the camaraderie of everybody from all over, So in January, I actually went to the conference, and it was just, I was like, oh, I'm not a medical doctor, and it was just so phenomenal, open arms and being able to connect with people and share ideas. And I think that anybody that imagines that you can work with someone's mental health without addressing their physical health, vice versa, or addressing their spiritual health, we're moving past that. And so it is really the most positive direction in which there is a shift in looking at, let me dare say, healthcare across the board, in which people are going to be able to come in and really talk about all the different areas that they can choose to focus on to heal, whether it's a physical ailment, a mental health ailment, or a spiritual ailment. Like, we will have some tools. And if it's not that we know what to do, we can certainly say, oh, but my colleague, Lisa's up in Fort Collins, let me connect you with her, and so that's that. And that's what it's about. Kind of like it takes a village, right? So really looking at caring for our health in that perspective.
Yeah, that's wonderful. And yeah, just a shout out to when you graduate, you're an alumni. You're part of this ever-growing group. We're almost to 450 IHeLp alums. We're over 2,000 fellows, and we all come together and we still hold space and platform for networking and connection. So it's not like you're here and see you later. It's like now you're a part of the awesome family, and it's glad that you could be here in January. Lisa, what are your thoughts?
Well, I got lots of thoughts, but I tend to be a little chatty Cathy, so I'm going to have to, kind of scale it back to the Reader's Digest version. But I just think the IHeLp program is a spearheading a movement that it's going like a train. And I just am so proud to be a graduate of the program. I think that there's a crosstalk that we, as clinicians, as healers, have been starved for a very long time. And I believe that it gave us a common vocabulary, a common nomenclature, a library of ways to dialogue with each other and to raise the bar for the healing work that we're all doing independently as therapists or PAs or nurse practitioners or whatever. It's just so great to be able to have a commonality in the cohorts that are coming from this program. And I think that confidently it is remodeling and will remodel healthcare as we know it. So it's great to be part of that.
I love to hear that, Lisa. That's our goal, right? We're going to change it. We're going to heal this system because it needs a lot of healing. Paul, your final thoughts. Yeah.
Yeah, the opportunity to be able to work with such like-minded people and to be a part of that, and to have that shared journey, to reach out to individuals and to help them understand that the expert for their life is not me or anyone else, but the expert for their life is the individual, and that individual has the ability for self-healing. And to me, that's foundational and the crux of everything they do, to help people understand that they don't need some external guide to help them reach the point they need to reach in their life, but they have within them that higher self, that innate wisdom to do what they need to do with their own life. And then each individual life is unique and different. And so to help them have the power and to embrace their own power and have the confidence to realize that their own body has a self-healing capacity is miraculous and wonderful and great news. And we have the opportunity together to help people see that. And then when I work with people, I said, my task is to help move that fog away so that you can look within and see your own innate wisdom and your own innate power to heal yourself. And so that's to me, that's wonderful. And I'm just grateful to be a part of a group, a movement that is focused that way.
It's beautiful, Paul. Thank you. So thank you for answering all my questions. We actually have plenty of time to see if anyone who's attending today has questions they'd love for our panelists to answer. And we can have you pop your questions in the chat, or you can raise your hand, and we will call on you, whatever works better for you. And while people are thinking about their questions, I will also have a couple slides that I can show just so people have a general sense of what IHeLp is. But we also host Q&As where I just go through details about the program and make sure it's a good fit for you and what you're looking for. But also to give you some dates, Morgan's on the call here, and she's our lead in admissions for IHeLp, and just to know the process and those steps. So, all right. And just so you know, because I have folks, they're, what do we call that when we are spotlighting folks, I won't be able to see everybody who's here and raising their hand without using the little raise a hand feature. I think we have a bit of a quiet group today. I don't see any hands raising just yet. So what I'm going to do is let people simmer a little bit, and I'll go through my slides really quickly, and I'll happily stop my slides if any questions come up, because you all have a great opportunity here with a very rich panel. So let me just jump to some of these key points here. There's our wonderful panelists. And Morgan, just holler if there's questions because I can't see anything right now. Some key points about IHeLp. It's mostly online. It's faculty and peer engaged learning. There's the self-care emphasis that we talked about. And everyone is placed in small teams that are faculty mentored. So it's a small class size to begin with. And then we want you to have support from a faculty mentor and a small group. Those are interprofessional groups. We don't break like the nurses into one section and the behavioral health folks into another. Again, just as Teresa was noting, we lean on that power that comes from learning across disciplines and being interprofessional and getting all those different perspectives is so helpful. You'll earn a certificate of completion, and it comes with alumni benefits, which all were mentioned. Some numbers here. It's an 8-month program. When everybody here on the call graduated, it was a 6-month. We've expanded it to 8 months to allow for more time in each week to do the work and really settle it in. So it's 6 to 8 hours of curriculum a week. We've incorporated virtual live sessions over the last couple of years. We call them healing talks. They're already all scheduled out. And if you have a phone, you can go ahead and scan that QR code, or Morgan will be passing along how to access the 2026 class schedule. So you'll see what dates are you needing to be synchronously connected with your class and what can be done asynchronously. We have the self-care team meetup. So your faculty mentored groups will join across 4 or 5 times across the program via Zoom. And we have a new virtual motivational interviewing workshop, as well as our beloved, none of us talked about it today, but the in-person educational retreat that we have here in Tucson at our awesome building, which you get to build on your learning from online to do hands-on and come together and spend time in community. just a highlight of those alumni benefits. People can list their practice on our public website, which lots of people use to find integrative practitioners. We give a 1-year access to premium alumni, which means we want you to keep accessing your educational curriculum, and we keep updating the educational curriculum. Search features available. We want to make sure you're still in touch with the latest literature, evidence, and approaches. You can connect, like I mentioned, across all students and alumni on our platform, as well as our alumni network offers free webinars, a quarterly alumni book club, and other special alumni only events. And most important, some dates. So thank you for attending, because you've attended one of our Zoom sessions. Morgan's going to get you a code that if you wanted to apply to IHeLp, your application fee is waived. And I highly encourage you, if you are really interested in applying, to do it before September 10th, because there's an additional $300 savings on the holding fee. And we have our scholarships are now open and available. So if that's something that would help support you in doing this program, that is available. Class begins online January 26th. So I'm going to go ahead and stop share because I am seeing some things in the comment down there. Let's see what we've got. All right. Thank you, Morgan, for putting the link in the chat. Sarah asked, can you speak to any specific mind-body modalities that you learned in the program and utilize in your practice? Anybody want to jump in?
I'll start just with a little bit. We reviewed guided imagery, and I was pretty much already familiar with it, but it was a great review. It was a hands-on practice, which was interactive, and it helped just kind of round out some of the familiarity that some of us may have already had. So guided imagery is just a very powerful way to sort of self-actualize something that you're focused on. And it's an ancillary approach to healing. So that's one of the ones that I remember that was really an integral part of this particular program.
Yeah, definitely dive deeper into guided imagery while we do more of a across the board on all. There's so many. Paul, you said.
Yeah, one of the things I do, I'm a EMDR certified therapist, and also addiction therapist. And one of the things that we do is group practice, group counseling, and always open up. And even with my individual counseling, open up with meditation. And so that is a guided meditation that I lead our group therapy classes with and individuals with, that is really, really helpful to those who are in the group and individually. That's a powerful modality to use. That's really helpful.
Thanks, Paul. I've gotten the pleasure of being able to be around one when you've done the guided meditations or mindfulness openings, and I've always enjoyed it.
Thank you.
Anyone else? Teresa, did you?
I was going to say, I recently just recommended, and I think I'm not going to say the word correctly, but the Qigong that we practiced when we were
Qigong.
yeah. I recently recommended that to one of the individuals that I work with, that he didn't want to do the guided meditation because it was too holistic, and I'm like, well, this is maybe something that you would be interested in. So it gave me the knowledge to have an in for someone who wasn't willing to do more the traditional guided imagery and all of that, but found it very helpful and soothing and relaxing to be able to learn that. So I appreciate how we also learned a lot more about just practices from all around the world and different cultures, and how to integrate some of the different cultural aspects into practice I think that speaks to a lot of clients that we see.
That's a great example. I love that because that was the first time we actually brought the Qigong hands-on into the retreat. But we teach it online. And yeah, that idea of like moving and being mindful and how that really is, it's about individualizing it for that person in front of you. What are they connecting with? What draws them to find that mind-body connection for themselves? I love that. Linda?
I mean, I'm going to have to agree with everyone. And so I went on and became certified through the VA in guided imagery because Belle Ruth Knapsack, who is a good friend. Yes, a good friend of the center. She is absolutely incredible. And we're so fortunate that she had created the educational modules for that. So if anybody wants to learn about, just look her up. I mean, just phenomenal, evidence-based, researched, and guided imagery segments for everything under the sun. And I also, with mindfulness, I got certified in VA Calm, which is a very smaller version of mindfulness-based stress reduction class from John Kabat-Zinn. And this is a very big part of everything that I do, offering people the option of starting with the mindfulness if they want. We do groups, and definitely pull in all of these elements of mindfulness and helping people just get in touch with their own bodies. We talk about the mind a lot, but even we forget that we're in our bodies. So it's now it's so lovely to be able to say it's a part of just the whole entire clinical program.
Wonderful. That's wonderful. And one of my favorites, breath work. That's just the fact that everybody's carrying their breath with them wherever they go, and you feel a moment of anxiousness, fear, whatever it is, you can always go to your breath. Matthew says, thank you for all the great information. When it comes to improving clinical practice for providers, how would this program differ for clinicians compared to the fellowship? I can at least speak to our 2-year fellowship is for prescriber level clinicians. So though I'm excited, Lisa, to hear that Colorado passed that. And I remember when Dr. Steve Gergovich was talking about it happening in New Mexico and just really expanding that accessibility. But on our list, you'll see PharmDs, nurse practitioners, PAs, MDs, DOs. I believe there's a DMD as dentistry that are eligible for the fellowship. And a lot of that fellowship is deeply tied into the board certification in integrative medicine. That is a MD and DO exam. So, but it's 1,000 hours. It's a 2-year program. They come in town 3 times for 4 to 5 days for each of those weeks. And what happens is you will see like it goes deeper into clinical approaches in the fellowship. So IHeLp is really talking about what are the foundations of integrative health and medicine, lifestyle, nutrition, physical activity, mind, body, complementary and whole systems, spirituality, and addressing those and through this tying in that self-care. And then if you look at the fellowship, you're going to be diving into GI conditions, oncology, deep cardiovascular, diabetes, rheumatology, all those condition-based focuses. That's like most of what the year and a half latter part is. So I'm not sure if that answers, or if you all have some thoughts around that.
I can't speak to the fellowship, so I'm not sure, but I can speak to IHeLp. It is transformational. It is a powerful, wonderful program. And if you have the opportunity to take it, I encourage you to do it. It's not only transforming, has the opportunity to make transformation personally, but also when you do business. It's a powerful program.
Thank you, Paul. I appreciate that. And I also look at accessibility, and that was one of my mindsets in designing the certificate program. Most of our students are working and working full time, and trying to balance life and studying. And so really looking at how much time is reasonable to devote to the learning, making sure part of that time is devoted to their own self-care and building community. So, the 8 months is a big commitment. But I think, as you've heard from our panelists, it can really change your life, personally and professionally. Well, I just want to thank everyone for coming and joining us. Linda, Lisa, Teresa, Paul, thank you for sharing your experience, your stories. So glad to have you part of our alumni, and I hope that we can connect again real soon. And please, anyone who has more questions, reach out to Morgan. She'll be touching base. Morgan, anything you'd like to say before we close?
Sure, thanks, Molly. Yeah, I think I'd just like to reiterate that now we are in our scholarship application period. So as Molly mentioned a little while ago, I will be following up with all of you tomorrow to include an application fee waiver. If you would like to apply for the IHeLp program, we'll go ahead and waive that for you. And then once you have your accepted program application, you can then apply for our scholarship opportunities. So those are going to be up to $1,500. The only prerequisite is that you need to have that accepted program application first, and then you can apply for those scholarships. We look at criteria such as motivation, impact on your community and beyond, and then also your financial need. And I tell everybody, even if you think you might not qualify, just apply anyways. The worst thing anybody could ever tell you is no, right? So I highly encourage you to do that. And then, as Molly mentioned as well, we're also in our early application period. So in addition to getting your application fee waived, you'll also get a discount between now and September 10th on your holding fee. So another opportunity to save some money there. So if you have any questions about scholarships or about the application in general, please feel free to reach out to me, respond to the email that I'll be sending you tomorrow. I'm also happy to schedule a one-on-one if anybody has, an individual situation that they'd like to, maybe talk through, or any questions. I'm happy to help. And that's all I've got. Thanks, everybody.
Thanks, Morgan. Thanks again to the panelists. Warmed my heart hearing everything. Thanks again for your time. Have a wonderful evening.
Bye.
Good. Great seeing you. Thank you.
Thanks, Paul.